and welcome to Mom Talks. Happy Friday to everyone. Hope you're having a great day and a great week, prepped up for the weekend. We are coming to you from the St. Louis Children's Hospital After Hours Clinic here on Tesson Ferry Road, and I'm here with Beth Schickler. She is a nurse practitioner at the After Hours Clinic, and I would just advise all of you out there, if you don't know about the After Hours Clinic, get to know the After Hours Clinic. It is a lifesaver. It's a facility, like I said, it's here off of Tesson Ferry Road, and it is open when your pediatrician's office is not open. So we've all been there, that scary moment when you go, oh no, we need to see someone and we need to go now. Pediatrician's not open. Do we make that trek to the ER? Can I wait till Monday? After Hours Clinic is open evenings and weekends, and we'll get into that in a little bit. But honestly, lifesaver, chance to get in, see a practitioner quickly, get a diagnosis, get the kiddo on the way to feeling better. So for today, we're going to be talking about those fun infections. Yep. You know the ones I mean. They come around every year. You will probably this winter be in a clinical space like this one talking about one of them. I know in the last year, looking at this list, we were in for, I think, 3 of these. So get ready. They run rampant at schools. They run rampant at daycare. Basically, if you leave your home, you are at a high chance of seeing something like this at some point. So we welcome your questions. Again, these are very, very common infections that we're going to be talking about today. You've probably run into them, or if not, you've heard about them. So we welcome your questions. If we're talking about something, you need some clarification, or if your child is seeing some symptoms and you're kind of wanting to maybe sniff out what it is, definitely leave them in the comments section and we will get to them. So we're going to start with a really fun one. Pink eye.
Yay!
Pink eye!
That's great. It's always good to see your kids' eyes goopy and messy. So pink eye can be caused from 3 different things. It can be caused from allergies, can be caused from bacteria, can be caused from viruses. Your most common one, especially in this time of year, is going to be caused from viruses. Kids with a viral pink eye can have really clear, runny eyes where they're just running, and usually it's both of the eyes. It's not one eye or the other. Sometimes they can be itchy as well, but really, really runny eyes. The white of the eye can be really bright red as well. And the kids sometimes can have a little bit of a runny nose, kind of cough, cold symptoms as well. From a bacterial type infection, what we all kind of talk about with pink eye, usually we're going to pick that up from somebody else, and it starts in one eye. And when you wipe it away, that green, yellow goop comes right back. So you're constantly wiping their eye. Allergies, you generally see kind of springtime and fall time. You're outside raking the leaves, you're rolling around in the grass, picking flowers, sniffing them. And it's usually then both eyes, they get really itchy, really, really watery then as well.
So what makes it so darn contagious?
Yeah, so bacterial and viral pink eyes, you're going to see those a lot in daycare settings, school settings. It's because they share everything, right? So one of my things I say is sharing is caring. Kids are constantly sharing and touching each other and exploring new things. And then they're rubbing their eyes, picking their nose, patting their friend on the back. So very, very contagious. Yeah.
I'm picturing my daughter, they're in that phase right now.
Right,
everybody's touching each other and sharing. Yeah. Oh, great. So let's talk about how is it treated?
So really need to have an exam by your healthcare provider. One of the treatments that we use specifically for bacterial is eye drops. Eye drops or an eye ointment, and it really depends on the age of the child and how well they do. But it's very easily treated with eye drops.
And is that different if it's allergies or if it's caused by does it basically differ on what's causing it, or is it kind of the same?
So for allergies, usually you treat the allergic, whatever you're allergic to.
Sure.
So it can be oral medicine that you take that your physician will tell you about, like a Zyrtec, Benadryl. Sometimes they'll have some nasal sprays that you can use. Sometimes they'll have eye drops as well. Whole host of different things specific for allergies.
Okay, well, how on earth do I tell my child not to rub their eye, and how do you keep this from spreading?
Yeah, that's really tough. Biggest thing is hand washing. So hand washing, especially this time of year, hand washing before the kids are eating, and kind of after they're at a play center as well. So if you're out and about, keeping that little alcohol hand sanitizer that you can use as well, just to kind of dab on their hands and rub their hands together, and then off you go.
Okay. Now, we've all kind of been there with the little ones. How do you do the eye drops?
Oh, I know,
it's
it's
not
terrible.
want to open their eyes.
Right.
It's awful.
I know, and usually when you have a really little kid, it's going to take two people to kind of help hold them down.
Yeah.
They don't have to have their eye open, watching that dropper come right at their eye. I usually tell parents, aim for this kind of inner corner of their eye, and then kind of help them gently open and close that eyelid. Eventually they are going to, and it's going to kind of wash right over the top.
Okay, because I know one of my biggest questions was, like, am I sure she got it, you know?
Right.
Okay.
And that really helps, just to have them lay down and then kind of blink their eye.
And good luck to you.
Yes.
Just a reminder that we are taking questions throughout the segment. We're going to move on from pink eye. Oh, what fun. And we're going to talk about a few of the other kind of upper respiratory infections that largely you see in really young children, babies. One that my daughter had last year was croup. And we got suspicious it was croup one night when we picked her up, and oh my goodness, she was crying, she was super hot, and just cough, cough, cough. Mm-hmm. So let's talk about what is croup.
So croup is caused by a virus in a whole bunch of different categories called parainfluenza. Mm-hmm. It's not the same as the influenza virus, just a little bit different. So what happens is the kids start with a runny nose, cough, sometimes a little bit of a low-grade fever for a day or two. And then they wake up from the nap. They sound like either a seal barking, or a family told me it sounded like Darth Vader.
Oh dear.
They really are working hard. You and I, we would call it like a sore throat, a hoarseness, a laryngitis. And little kids, that little voice box right underneath it becomes smaller. And so then when they are breathing in, you hear that high-pitched kind of barking cough as well.
Can we talk about how serious croup is? Because I know when my daughter had it, we were new parents, and so we rushed off to the ER right away. Can you talk about how serious is it, and what should parents do?
Right. So croup you usually see in kids that are 6 months to about 3 years old. The smaller they are, and if they have some underlying issues kind of in their throat or in their airway, that little airway can get smaller. So if you are hearing that kind of croupy sounding cough, working hard to breathe, and if they have color changes, those are very serious things. Kind of some things that you can...
Scary.
Very scary. Some things that you can do at home, if you just hear that cough, but they're nice and pink and they're drinking well, is to steam up your bathroom. Make it nice and hot and steamy, kind of sitting there with them. It's like doing a humidifier. Then if you either open the freezer door or go out into the cool night air, that's like putting an ice pack right onto that little area right there. If you're not noting, and someone should be kind of on the phone with your pediatrician or your doctor's exchange as well and say, hey, what are our next steps? What do you think we should be looking at as well?
When should you get more concerned?
Right. So if you're hearing a lot of sounds when they're breathing in and breathing out, any color changes around their mouth, and having difficulty kind of catching their breath as well. Those are all things we'd want you to seek emergent care for.
Okay, see, whenever we went, I remember being surprised because they did breathing treatments with her, which, made a lot of sense to me, but they also did an x-ray and a chest exam. Can you explain a little bit about what a doctor or a nurse practitioner will be doing to do a diagnosis?
Right. So a lot of it is listening to the symptoms and hearing them as well. So an x-ray you don't necessarily need all the time unless they're either not responding to the breathing treatments or there's concern that they may have ingested something or inhaled something kind of into that airway. Or they're hearing something that's different kind of down in their chest. Because usually you just hear the sounds kind of up here in their neck as well.
So what do the breathing treatments do? Is it kind of like humidifier times 100?
Yes, so kind of like that, and really what it does is probably racemic epinephrine, maybe is what they gave her. So what that does is it helps decrease that swelling right on the airway. Kids usually respond very quickly, but it takes a very short amount of time that it's in your system. So usually within that 2 hours, sometimes they can give you a steroid as well to help kind of decrease that inflammation. Right. So as that steroid is kicking in, that medication, that inhaled medication they gave her, would be starting to decrease then as well.
I think what a lot of parents parents think, especially with something like croup, is that because it's coughing and it's all up here, it can look sometimes like a cold, or you're not sure, is it a cold or is it something worse? How does it differentiate?
Yeah, that's tough. So in older kids, it will be kind of a common cold for them, or they'll say that my throat hurts and they're running a little bit of a fever, or they're really hoarse as well. So it is a little bit different, but in the younger kids, you're going to hear that kind of high-pitched barking cough, or they sound hoarse, or you hear those extra sounds when they're breathing in and out.
And parents, just so you know, you can search engine what does croup cough sound like, and there are videos actually out there that play it.
Right.
I must say I did do that a couple of times to listen, and then she'd cough and I'd play it, and it's helpful. So just if you're not sure, it can help. Obviously, it's not it's not a practitioner, but it's
right.
It's something. So once you have the diagnosis for croup, what's the next steps as far as treating it at home?
So treating it at home would be kind of all the same things we do for a regular cough or cold. So lots of fluids, cool thick fluids, popsicle jello, ice cream, soups and broths help as well. Those little fruit pouches that kids like to eat, if you put those in the refrigerator, that helps when they're drinking and eating those. Tylenol and ibuprofen if they're running a little bit of a fever, if their throat just hurts. Yeah. I can't really tell you why. And then the steamy shower and the cool night air. That works really well.
And just time, I imagine. So.
Right. Yeah, and usually it gets to be about worse between about day 3 of being sick, and then kind of peters down by about day 5 to 7.
Kind of going hand in hand with croup. When you hear about croup, a lot of times you often hear about RSV, especially when you're talking about littles like toddlers and babies. So I remember when I was a new parent, I just didn't even know the difference. So can you talk a little bit about what RSV is and how it's different from croup?
Right. So RSV is one of those viruses I think a lot of new parents hear about. Kind of goes, in my mind, hand in hand with influenza. It can be very scary to hear about. And then once you hear about, yes, my child does have RSV, then kind of what are the things I need to do? So RSV is a common childhood illness. Almost all kids, by the time they're 2 years old, have been exposed to the virus and have had the virus. What differentiates that? They both start off the same. Runny nose, a little bit of a cough, sometimes a low-grade fever. For RSV, kind of goes down into their chest, where you'll then hear some kind of wheezing breath sounds. So extra breath sounds when they are breathing out or breathing in. Sometimes they'll be working harder to breathe. So pulling in underneath their ribs, pulling in up here, and their little nostrils will kind of flare out as well.
I remember they said if you can see ribs, like when they're inhaling, you see ribs, that's not a good sign.
Right.
I honestly don't know the answer to this question ahead of time. Is it does it fall in the same bank as like a pneumonia or a bronchitis?
Yeah, so in little kids we call it bronchiolitis because the end part of their airways are so teeny tiny and they get clogged and sticky with mucus. RSV is a virus that you and I can get, and it's a common cold. We can have lots of runny nose, cough, cold, and then little kids, they're working harder to breathe, and just a ton of upper airway congestion, lots and lots of snot then as well kind of coming out of their nose.
Just a reminder to everyone that we are taking questions throughout this segment, so if you're hearing some things that are concerning to you or they're resonating with you, please go ahead and write into us and we will make sure to address those as we go along. So I also want to know, how do you get a diagnosis of RSV?
So RSV is a clinical diagnosis. Your healthcare provider will listen to the symptoms, listen then to the chest and do an exam. There is a test for RSV, and it's a swab in the nose. It feels like, if you've ever had a swab for influenza, it's about the same, where they go really far back in the nose and get a good swab. And then that test would be definitive to say, yes, the symptoms they're having is caused from the RSV virus.
RSV is the one that I've kind of heard about, that after a while it can get scary if it's not treated. So talk to me a little bit about why is this one maybe to watch out for?
Right. So RSV usually gets worse again, kind of like croup, about day 3. Between days 3 and days 5 are when they're at their worst, and then gets a little bit better as that time goes on. Kids with RSV can cough for about 2 to 4 weeks after the virus. RSV also, because your body is working so hard, some of those kids can get another infection on top of it as well. So they can get a pneumonia, sometimes because of all the snot that they had, and they can get an ear infection as well.
Oh,
so
no.
I know. So kind of about the day 5 mark
Yeah.
or so, you start to feel a little bit better. And then if they start to then cough harder, start to run fevers, those would all be reasons then to call back your healthcare provider and say, this is something we need to look at again. But going back to your point, so little kids can start to breathe harder as well. So some kids will need a little bit extra support, either because they're breathing so hard they can't drink enough, or they're breathing so hard that they can't keep their oxygen saturation up, meaning that they need a little bit of supplemental help or support just to kind of get them over the hump of RSV.
So talk a little bit about how it's treated.
So treatment is supportive care. There's no antibiotics or antiviral medications that are going to help treat it unless there's another infection with it as well, like an ear infection or pneumonia.
And that'd be a pink stuff kind of thing.
Yes,
the amoxicillin or something similar.
Yeah, something similar. So treatment is lots of nasal suctioning before bedtime, before eating, kind of helping to prop them up. Humidity, wording that cool mist humidifier works as well.
And I've got to put a plug in here. You moms know about those suction things where it's the put one in the mouth, one in the nose. They're disgusting. They work great.
Yeah, the nose, yeah.
Yes. Or those, and of course there's those little bulb syringes that I'm sure we
syringes,
all got whenever our babies were born. So, okay, so RSV sounds practically miserable. So, especially for the littles, how do you keep it from spreading to your other kids?
Oh yeah, that's a tough one. Lots of hand washing and then trying to avoid sharing. So some kids really love to share with their siblings, love to give kisses. So in our older school age siblings, they love to hold the new baby, love to give kisses. Kind of kissing on top of the head is fine. But lots of hand washing when that older kid has a cough or a cold, making sure to teach them to wash their hands, blow their nose, after they blow their nose or before they're eating, washing their hands as well. Those will all help.
Because it can't help. I mean, you can't help a baby and tell a baby, okay, cough into your arm.
Right.
Goodness. So, okay, so just a reminder, once again, we are taking questions. We've talked about pink eye, we've talked about croup, we've talked about RSV. Now we're going to move on to one that I know I was hearing something about recently, and knock on wood or nothing in there, but hopefully cross fingers. My daughter has not caught hand, foot, and mouth, but I heard a lot about that one as summer was transitioning to fall. So what's hand, foot, and mouth?
So hand, foot, and mouth is also a virus. So you see the same thing from hand, foot, and mouth as well. It's generally a summer and early fall type of virus. And some of those kids will then have a runny nose and will run a low-grade fever, generally nothing over 101. And it's caused by a virus called Coxsackie virus. That's the main one, and then there's other viruses called enterovirus that can cause that as well. Some of our little kids, our little babies, will run a little bit of a fever and may not want to drink, or are really fussy when we put that bottle next to their mouth. Then you may also notice kind of flat little vesicles on the bottom of their hands, on the bottom of their feet. Sometimes you'll see them in their diaper area as well. Some little kids that cry, you will see them kind of in their mouth.
Ouch.
Yes, they can get them on their tongue. They can get them on the back of their throat as well. Some of the viruses that cause that can also, you can break out into a rash along your face. You can actually break out into a whole body rash as well.
Wow. So for starters, what causes that? Oh, I'm sorry, you answered that already. So let's talk about what makes it so contagious.
Right, so it is a virus that's spread from oral or fecal, so it's shed in the stool, to oral routes. So some of our little kids in daycare, if they're getting their pants changed, or they're running around with maybe some poop in their diaper, again, sharing is caring. Everybody's touching everything, and there's, hey, here, you taste this, I'll taste that. So then it's very easily spread. Same thing at home, and it goes back to hand washing as well.
I laugh because it's true. So explain a little bit about the blisters. What might they kind of look like?
Yeah, so they can be kind of a grayish hue with like a red ring around it. Some of them can be fluid filled, and some people, are concerned that maybe another virus like chickenpox.
That's just what I was going to ask.
Right.
How do you tell?
Yeah, so this type of virus with hand, foot, and mouth doesn't itch. Some kids with chickenpox, they're very itchy.
Absolutely.
And also running high fevers as well. With hand, foot, and mouth, you see it on the palms of the hands and soles of the feet. With chickenpox, it starts at your head and works its way down. But chickenpox is very easily preventing contamination or transmission by getting the vaccine.
Yeah, it's not what it used to be.
Right. So hand, foot, and mouth, there's no vaccine for that. And treatment's just supportive care. So Tylenol, ibuprofen, and just really keeping a good eye on them. Again, those cool, thick fluids, popsicle Jello ice cream, soups, and broths.
I know probably people are asking, well, how long? And are they just going to clear up on its own?
They will.
Wow.
They will clear on their own, and they generally take, once you see those blisters, 3 to 4 days before they totally clear up. Some kids can have some peeling of those blisters. The fluid that comes from them is not contagious.
So I'm sure with a lot of these, a lot of us are thinking, okay, my kid has hand, foot, mouth. My kid had pink eye 2 days ago. Can they go to school? Can they go to daycare? It's the $1 million question. What do you typically recommend for a lot of these, these viral infections?
Right. So as long as they are fever-free and they're feeling good, if they have pink eye and they're undergoing treatment, they're okay to go back to school. But biggest thing is if they're not feeling good, they're not going to want to be at daycare, probably interacting with other people that aren't mom and dad or grandma and grandpa. And then you just really need someone to keep a close eye on them, make sure they're really drinking well, especially with hand, foot, and mouth.
Sounds good. So we've been, looks like we have a question.
So I know you hear a lot, one of our viewers has messaged in with this question. They're hearing a lot, get out of the cold before you get sick. Is it true that the cold weather can lead to some of these illnesses?
Put your hat on, put your gloves on, you're going to get sick.
Right. So no, the illnesses are caused from viruses, and we just have lots of viruses this time of year. We're also going out and we're doing lots of shopping, and we're going to places that there are lots of people. So then we have lots of opportunity to share and to share our viruses and share our germs. Again, goes to good hand washing and wiping off that cart before you hit the grocery aisles.
I don't like to think about, when I open doors, I'm like, every once in a while. So it's just about being proactive about your surroundings. We're not in summer, we're outside and we're in the great outdoors, but in the winter we all tend to congregate inside and into confined spaces. So good. So let's talk a little bit about the after hours clinic. You're about to celebrate a birthday.
We are. We're going to have our first birthday. We're very excited. Next week, Tuesday, we'll be open 1 year.
That's exciting.
Very exciting. So we're open Monday through Friday from 5 p.m. to 11 p.m. Saturday and Sunday, noon to 11 p.m. Since the holidays are coming up, we are going to be closed on Christmas Day, but Christmas Eve will be here from noon until 7 p.m.
So talk a little bit about the need for this kind of a facility, an after-hours clinic. What are we accomplishing with this?
Right. So we have lots of kids that either get sick on Friday evening or on Sunday. Mom and dad have to go back to work. A lot of times it's just we need some reassurance, more supportive care. Sometimes that you need antibiotics so that you can go back to school. Our school-age kids with strep throats, we can get them started on antibiotics. They're back at school. Mom and dad are back at work.
I mean, goodness knows that when your child gets sick, it is not always a convenient time. The pediatrician's office might not be open.
Right, definitely. You come home, pick them up from daycare or after school, and they're sick, running fever, or they have pink eye.
Yeah, right. We've been there. So.
Yeah, absolutely. We also do x-rays as well. So slips, trips, and falls, those generally happen as well, nights and weekends. We can help you with that as well.
And oftentimes, parents might say, it's an infection, it's pink eye, it's after hours, I don't want to go to the emergency room, but I also don't think I can wait until Monday to get started. So it provides that kind of a immediate service during the hours you're open.
Yeah.
So can you remind everybody about when you're open and where you're located?
Sure. We are located, I'll give you the address. It's 12436 Tesson Ferry Road. We're in the Deerberg Shopping Plaza as well, kind of right there smack in the middle. And then we're open Monday through Friday from 5 p.m. to 11 p.m., Saturday and Sunday, noon to 11 p.m. Then coming up for the holidays, we're closed on Christmas Day, open on Christmas Eve from noon until 7 p.m.
Okay, that should clear. Thank you so much for joining us today and
Thanks
telling us a little bit more about all of these fun things that I'm sure you're starting to see and will see a lot of this winter. So once again, we're going to be closing this episode, but if you still have questions, feel free to leave them in the comments section. So we have 2 more episodes left in this series called Baby It's Cold Outside. Next week, we're going to be back at St. Louis Children's Hospital talking to Dr. Jamie Condis. She's an emergency room doctor, and we're going to be talking about slips, trips, and falls. And when it gets snowy, when it gets icy, it's just going to happen. Your child is going to slip and fall, or if you're like me, you will slip and fall. So we're going to be talking about things that she sees in the emergency room over the winter months, especially when it gets snowy and icy, and maybe a little bit about how you can prevent that whole walk like a penguin thing. We're going to find out if that is true or not. Until then, we'll look forward to seeing you on Friday. Have a great day and a great weekend.